Hi, I'm Mike Le Couteur, and this is the West Block, politics, perspectives, and players.
The government alone cannot win this fight. We all have to answer the call of duty.
We've taken unprecedented measures.
Taken measures to limit traveling in the north of Quebec. We are also one of the places that test the most in the world.
There is no way to beat a global pandemic if we're actually not willing to work together as a globe. No country is an island.
9/11 didn't have this many calls.
They're essentially already at capacity.
The peak in fatalities will not arrive for another 2 weeks.
Over 1 million infected, dire situations in assisted living complexes, uncertain supply chains, and a lack of protective equipment. COVID-19 continues to wreak havoc globally and here at home.
Social isolation can be hard on people. And my message to everyone watching today is this: you're not alone. We're listening. We care.
That was Ontario Premier Doug Ford addressing mental health issues many people are facing with this new coronavirus. Now, one professor at the University of Toronto recently launched a free online course to help people manage their mental health. Joining me now from Toronto is Professor Steve Joordens. He's a psychology professor at University of Toronto. Thanks so much for joining us. First of all, tens of thousands of people have registered for this course. What led you to pull all this together?
Yeah, well, I mean, one of the things I say in the course is that when we're feeling anxious, and I think just about all of us are feeling anxious right now, myself included, our body kind of gives us this command to do something. Usually it wants us to fight or flee. In this condition, you try to figure out what that is, and we can't really flee. So fight, how do you fight back? And, you know, for me, it was just, this is something I know a little bit about, and I can help people kind of understand their anxiety response and how to manage it, which really isn't that hard to do. So I just wanted to share some of that and hope it would help people as they face the challenge that we're all in right now.
You say it's not hard to do, but so many people are dealing with this now and they don't know what to do. So give us a bit of a preview of your course. What kind of advice is most useful to people during these difficult times?
Yeah, well, I have one part that's a little complex to get into, but it just it describes the actual fight or flee system and how it arises, and talks about something called guided relaxation, that you can actually learn to kind of conjure relaxation and put your body into that state. And that's, you cannot be both anxious and relaxed at the same time. So if you can really learn to put yourself into a relaxed state, you can kind of turn off anxiety. But, you know, that's the sort of fancy psychological technique that I try to teach people as they go. But a more sort of mundane approach is to literally pay attention to what activities and stimuli in the environment do to you and manage them. So for example, just a quick one, the news. You know, your bread and butter. We're all really hungry for information right now. In fact, we can kind of get addicted to it. But the news also makes us anxious. It tells us about the threat. And so some of us have the news on all day. Bad idea. Budget your news. Maybe have something funny after you watch the news, something to bring your mind somewhere else. And, you know, there are other stimuli and other things you can do that will actually help your anxious state. So I try to get people to think about that. What are these various things? How do they affect my mental health?
And how difficult is it to manage that when you consider, you know, the numbers and what we're seeing either from different countries or even here within Canada, when we see the, you know, projections or the trajectory of these curves, how it can really affect people, and how are people supposed to manage all of that? Because they say information is power, but if they have too much of it and governments maybe aren't releasing it because they're concerned about that, how should people manage that themselves?
It is just, you know, we use this word unprecedented more than we've ever used it before, but it is. And so the system, our basic system, was meant to deal with a bear stepping in front of us, you know, a very defined threat, and we either fight it or flee. We've got this vague, very powerful thing that's threatening multiple parts of our life, which is why we all feel so anxious. But I mean, one answer is things like distractions. So if you live in it, which you probably do, and I kind of do now, we're marinating ourselves in all this stuff, it's really tough. But you have to learn to say, okay, I got the information I need, and now I'm going to pull my mind somewhere else. And there are ways to do that. There are certain stimuli that you might find engaging. There are things like learning and bettering yourself while under isolation, maybe taking a course on something, trying to bring some normalcy to your life. And yeah, it's a difficult thing to do. And every time we go back to this current situation, that anxiety is going to come back. So it certainly isn't, here's how to get rid of anxiety. It's more like how to live with that annoying roommate that you have. And we all have this annoying roommate anxiety that keeps popping its head up now and then. So how can we learn to live with it? And part of it is just not have that roommate in our face all the time.
And that roommate, unfortunately, rears its ugly head so often. And one of the issues is that we need to hear from the roommate. For instance, maybe I'm taking the roommate analogy a little too far here, but the government continues to say that physical distancing is so important, and they're not really giving us, just because they don't have it, that any light at the end of the tunnel, saying that this distancing is going to last possibly for months, weeks for sure. So how difficult is it for people to manage that stress with so much of the unknown that they don't know how long this is going to go for?
Yeah, so first let me say thank you for using the term physical distancing. It should be our new term. We should be socially cuddling, I guess, but socially cuddling while physically distancing. I think that's the real change. One of our most basic ways of dealing with anxiety and grief and trauma is through emotional connections with other human beings. And this is a huge challenge now because, for example, the ultimate form of that would be the hug. And we know psychologically hugs do a lot of good. But of course, we can only hug so many people now. And so we have to learn how to emotionally connect with other people. I think we have to learn this new way of being and realize that, yes, this will end, but it may not be the end. There are pandemics on a regular basis. This could be seasonal. We should be looking at this as a way of learning this way of being. Because yes, it'll pass, but we may come back to this way of being at times. And so learning how we can kind of redefine our life at home, how we can manage all of these stresses as we go, we will find that we can get through it. Humans are much more resilient. My parents went through the war as young children in Holland, and I hear the stories, and it just, used to make my mind go whatever. But when a world is as it is, and once you get settled into that, it's amazing how resilient humans can be. But some coping techniques along the way can really help that along.
And I hope that a lot of people sign up for your course and that it helps a lot of people in these times where we just don't know what's going to happen and we need to deal with this anxiety. We're going to have to leave it there, unfortunately, Professor. Thanks so much for joining us today.
Thank you. Have a great day.
Well, that's all the time we have for today. Thanks so much for joining us. For the West Block, I'm Mike Le Couteur. Stay safe, everyone.